Hi there, and welcome to the Ultimate Perimenopause Podcast. I'm Dr. Shawna, and unfortunately, due to a power outage, I'm here without my co-host Maggie Chilton. I'm really excited to share some great information with you today about breast cancer prevention. I'll be speaking today with Sat Dharam Kaur, who's a naturopathic doctor with over 20 years experience, who has a practice in Owen Sound, Ontario. She has three great passions: Kundalini yoga, naturopathic medicine, and environmental sustainability. She's the creator of the Healthy Breast program, which teaches strategies to prevent breast cancer and to assist in recovery using natural therapies in conjunction with conventional diagnostic and treatment options. I took this program myself early in my career, and it was fantastic. I'm so grateful to have you join me today. Welcome.
Thank you, Shawna. It's great to be here.
So I wanted to start by just getting to know you a little bit better. I've only met you in the context of your teaching. And first question is, how did you get interested in working with women with breast cancer? Because this has been something you've taught for years now.
It has been. When I was in my third year of naturopathic college, two things happened. One, I got pregnant. And two, a woman that was living in the same house as I was living was diagnosed with breast cancer. So I lived in a large sort of communal house with about 18 people. One of those women was diagnosed with breast cancer. And she reached out for help from me. And it was a very, very intense time. And as I looked around to see what was available, it was obvious that there was nothing available at the time that was sort of an integrated approach to help someone deal with breast cancer or even prevent breast cancer. And so I started to pull all this information together. And she eventually died, maybe within the year, just after my daughter was born. And so that marriage, birth and death so close together had a big impact on me. And somehow this passion for breast health was initiated by her disease. And then as I investigated more about it, I was incredibly affected emotionally by what I discovered about specifically the environmental links to breast cancer, because I had no idea that there were so many environmental links to breast cancer. And I got really angry. Well, first I became paralyzed and kind of full of despair. And then I became angry and just said, well, this is a good cause. Because I've always had a really strong connection with the earth and sustainability, and really, as a naturopathic doctor, really feeling that the earth is our mother, and that I'm in pain when the earth is in pain, sort of deal. I have this strong connection. And so my feeling was, if I could educate women in ways to reduce the risk of breast cancer, including some of the environmental strategies, then perhaps together we would be a little gentler to the earth. And what was needed was almost a revolutionary shift in paradigm in terms of how we relate to the earth. And what better way to do that than through women working with other women. So that was part of my mandate within myself, is I need to teach women to educate other women in how to reduce the risk of breast cancer, because in doing that, we can also decrease the negative impact we're having collectively on the planet. So that was part of my mission, is not only to help heal women, but in so doing to cause less damage to the planet, to protect also other species. Because as I started researching in the beginning, I was aware that cancer was affecting whales and seals and polar bears and walruses and other sea mammals especially. And the question was, who are they going to go to for help? They don't have doctors, right? So it was us that was causing it. So that became something that I've never lost passion for. The whole thing, the whole big thing of just working with women, protecting the planet for future generations, protecting the planet for other species, and just doing what I can in my own way.
That's beautiful. I'd forgotten about the enormous environmental link with you. My background also and started with some environmental work. I was an environmental engineer before going to naturopathic college.
Right. So you know
And
it.
yeah, absolutely.
Yeah. Yeah.
Absolutely. So what are some of the environmental links that you've come across and some strategies? Can we dive into that a little bit first?
Sure. Let's sort of summarize it. So there's four primary environmental categories linked with breast cancer. One is radiation, which could be from excess number of X-rays in women, whether it's children that were X-rayed a lot in the early years. I had one woman who was irradiated for an enlarged thymus gland when she was a baby. This was many decades ago when she was irradiated, but that was a treatment for enlarged thymus glands. And so she was diagnosed with breast cancer in her 40s. I had another patient once who was born in Russia, and she was close. She grew up not so far from where they did a lot of nuclear testing, atomic bomb testing. So she was exposed to that kind of radiation. I've had other patients who were airline stewardesses exposed to frequent radiation. So radiation, as we know, it damages DNA, and enough of that over long enough time can cause a woman to be more susceptible to breast cancer, including repeated mammograms. So an excess amount of mammograms is also potentially damaging. So radiation is one category. Another category would be electromagnetic fields, strong electromagnetic fields. So this is a difficult one because we have no idea, how Wi-Fi use, cell phone use, and cell phone towers, radio towers, just the increased reliance on the internet and wireless technology is going to affect our health. We have zero idea about that, and we know it affects the brain, but there's some research showing that women who were exposed to chronic exposure to strong electromagnetic fields have an increased risk of breast cancer. Electrical engineers have an increased risk of breast cancer. Exposed telephone line workers have an increased risk of breast cancer. So there's that other category. Another one would be simply the environmental chemicals. So that's a big category. So many of the plastics contain either phthalates. It's a funny word spelled PHTHALATES. And those phthalates mimic estrogen in that they bind to the estrogen receptor. They can initiate breast cancer. They can collect in our fat cells. The breasts are fatty tissues. So the problem is that many of these environmental chemicals are fat-loving. And it seems as though the body stores them in a part of the body that we can live without. So it's better stored in the breast than the brain, for example. And the breasts have, the size of the breast is primarily determined by the number of fat cells in the breast. So we dump these environmental chemicals in the breast, and then they have a lingering chronic estrogenic effect, which then can cause breast cancer. So the phthalates is one category, and then bisphenol A, which is found in hard plastics, is another category. Chlorine plus carbon together. So the organochlorines is another category that mimics estrogen. Many heavy metals are called metalloestrogens. They also bind to the estrogen receptor. And some strong solvents bind, and then pesticides bind. So there's way too many ubiquitous, and the other one is fire retardants too, ubiquitous chemicals that we're all affected by. And we literally would have at least 200 of these in our bodies now. And they have a synergistic effect together to increase the effect of estrogen. They bind to the estrogen receptor. They act like estrogen, and they are hard to get rid of unless we sweat them out. So that's another category. So we have radiation, we have electromagnetic fields, we have the environmental chemicals, and then we have the heavy metals. So those are the primary environmental links to breast cancer.
Okay. So I really want to frame this discussion in a proactive way so that our listeners can learn some of the risk factors, but also some actions that they could start taking right away to reduce their risk. Because when we start getting into the environmental risk factors, it does sound pretty dire and, impossible to escape.
Yeah, when I teach the Healthy Breast program, I warn people in advance with that module, and I say, this one's depressing, but there has been a lot of positive change in the last, let's see, I started teaching this in about 2000. Actually, no, 1990 I started. There's been a lot of positive change in the last 20 years.
Yeah.
And there's new factors creeping in, like the electromagnetic fields, but we have reduced pesticide use. We have reduced certain plastics, you know. So that's the good news.
That's the good news. So do you believe that if we start, you know, if a woman starts with proactive strategies in her 40s, she can greatly reduce her risk of breast cancer?
I think we can reduce the risk of breast cancer by about 90% with a few basic strategies.
Well, there's some place to start.
Yeah. So maybe I can list these strategies, the simple ones, in area of, I'm not sure if it'll be importance, but it'll be close. So we know that if we have optimal levels of vitamin D in our system, that we can reduce breast cancer risk by up to 60%. So that's huge. So in Canada, it should be at least 150 is the amount of your vitamin D when you get it tested, between 150 and 180. So it should be high normal. And that number will reduce your risk of breast cancer by up to, I can't say it's going to be 60%, but up to 60%. So we know that northern countries, generally Northern Europe, Northern Canada, generally have more breast cancer because we have lower vitamin D levels, because we don't spend a lot of time in the sun, you know, and tropical countries have generally less breast cancer. So that vitamin D is critical. So women should, especially between age 35 and 55, because that's when breast cancer tends to be more dominant as a risk, you know, should have their vitamin D levels tested annually. And now you have to pay for it. Before we found out that vitamin D was so protective, but it was free, you know, oh, you're covered. And as soon as the news came out that vitamin D was so protective, then women had to pay to get it tested. I don't understand that. But anyhow, pay to get it tested and test that annually and take your vitamin D and spend a little 15 minutes a day in the sun between 10 and 2 if you live in a sunny environment. But I find that most women in Canada need, you know, from their blood tests, for me looking at their blood tests and seeing what works, is about 5,000 international units a day. It seems to be the norm of what we need. The second thing would be to exercise 40 minutes a day. So exercise 40 minutes a day, 4 hours a week, reduces the risk of breast cancer between 30 and 60%. So it's another huge factor. And that doesn't have to be much more than a brisk walk. You know, so it's not asking women to do the impossible. It's just walk 40 minutes a day. So that's a huge thing. Something else would be so there we're down almost 80% right there. You know, if that's like 80%. And then we know that certain foods are incredibly protective, and there's a lot of confusion around some of these foods. But one of the biggest categories of foods that's very protective are the phytoestrogens. And the way it works is that any hormone, including estrogen, only can act when it attaches to a receptor for that hormone. So unless it attaches to a receptor, it doesn't do anything. So our bodies make many forms of estrogen, some of them which are strong, very strong, and they cause, one of the effects of estrogen is to cause breast cells to divide more quickly. As those breast cells divide more quickly, there's a risk of there being a mistake in cell division, which then could initiate the cancer process. Or there's a tendency then, if there already was a mutation in the DNA in that breast cell from, let's say, radiation or plastics or something, then that cancer would grow faster because the cell is dividing faster, okay? So something will attach, we have a certain finite amount of estrogen receptors in the breast, and some form of estrogen has to attach that receptor to cause an action in the DNA. But we can manipulate that by having a weak protective estrogen attached to that receptor. So then it sits on the receptor and it just blocks either the environmental estrogens or the body's strong estrogens. So then it dampens the whole estrogenic effect, right? So the strongest phytoestrogen, the most protective phytoestrogen in foods is ground flax seeds. And second is organic soy. So I encourage people to take at least 2 tablespoons of freshly ground flax seeds every day Try to eat them within 15 minutes so the oil doesn't go rancid. The phytoestrogens, which are known as lignans, are found in the seeds. There's very little found in the oil. So you need the seeds for the phytoestrogens. You need the oil for omega-3, the omega-3 fats, which are also protective, but in a different way. They decrease inflammation. And then we want to use organic soy, about 11 grams a day, not very much. That's a half cup of tofu or 1 glass of soy milk, or so maybe a half a cup of edamame, so organic soy often. The other class of foods that's a phytoestrogen are pumpkin seeds. So pumpkin seeds are also very good protein for vegetarians. So I myself use fairly regularly a pumpkin seed protein powder that I put in my smoothies. It's delicious. Or I make pancakes and add it to pancake mix, So to use one of those phytoestrogens every day is a great idea. To take an omega-3 supplement every day, or to add flaxseed oil to your food. Like we have a bottle of flaxseed oil, dark brown glass bottle, keep it in the fridge, never cook with it, put it on the table at dinner time, and pour it on your beans, pour it on your rice, make it a habit. And that's pretty easy. So because omega-3 oils inhibit cancer growth and they're anti-inflammatory, they're also protective. Another tip would be to make sure that you're sleeping in a dark room at night, because the hormone known as melatonin is secreted in the dark between 1 o'clock and 3 o'clock in the morning. The higher your melatonin levels, the lower your risk of breast cancer. The lower your melatonin levels, usually the more aggressive the breast cancer. So melatonin is very protective. It helps normalize cell division. It helps normalize the body rhythms. It's known as an anti-aging hormone. It's a little bit of an antioxidant, but it also decreases the number of estrogen receptors. So if you can decrease the number of estrogen receptors, you can decrease the effects of estrogen on your breasts. So we need to be sleeping in a dark room at night. That's another thing. In terms of what to do about all these environmental chemicals that are in our system, there's a few things we can do. One, we can rethink the age at which we have our children, and have our children at a younger age, because these environmental chemicals are cumulative. So the older we are before we have a child, the more environmental chemicals. Also, the younger you are when you have a child, your breast cells mature fully only when you give birth, and then they're more stable. So it has to do with the hormone balance in breast cells. And so having a child at a young age creates stability in breast cells, then they're less vulnerable to cancer. Not only that, but we'll have fewer environmental chemicals if we have our children at a younger age. So we kind of have to rethink society. That's a big one. It's like, how can we support women giving birth at a younger age, and, both educationally and with childcare and with partnerships, and just how to raise children properly. I mean, that's something I think we should think about. I was in China last year and the year before, and I was, China has a very low rate of breast cancer compared to other countries, industrialized countries, although it's increasing rapidly. But one of the things I noticed is that Chinese women can work for 15 years, and then they receive monthly pension from the government, and they can retire. They retire at age 50, so that they can so that as a society, the grandmothers can be with their grandchildren. Isn't that amazing? It's like amazing.
Yes.
Yeah, amazing. And so then there's much less stress for the new mothers, and the new mothers have the support and just the education and the mentoring, from the grandmothers. Anyhow, I was just amazed that the whole society works that way. So we need something like that, so that young women then can afford to and have the time to have their children. So we have to restructure society. And then the other thing I'm big on is just educating people about how important it is to sweat. Because I have estimated from a little research I did with a company known as Sonoray, and Sonoray sells these beautiful infrared saunas. I did a study with Sonoray on about 15 people, 15 years ago, probably, on how how many environmental chemicals you can sweat out in 50 hours. So we took these people and we had a little control group, and they did 50 hours of sauna-ing, and we measured pesticides, bisphenol A, fire retardants, and heavy metals before and after, and compared them to the control group. And we found that the heavy metals decreased 35% in 50 hours of being in the sauna. And most of the other environmental chemicals decreased 25% in 50 hours of sweating. So if we want 100% reduction in our biological accumulation of environmental chemicals, we might need at least 150 hours of saunaing. So this is my big hope, is let's educate young women to sweat in a sauna or in a sweat lodge or through exercise intensively for 150 hours as a big dump, and then maybe 2 hours a week as a maintenance after that, so that they can decrease their body burden of these environmental chemicals before they get pregnant, because we pass them on in utero and through breastfeeding to the next generation, and thus each generation has a bigger load, and therefore we get more breast cancer, you know? So this is a huge thing. It's just we have to train women to go into these saunas and do this sauna detox before they get pregnant. Something else is because the plastics are mimic the hormone estrogen. Many of them do. Any plastics that contain phthalates or bisphenol A, including many containers we store our food in, and including some canned food that's lined with the plastic liners, usually is bisphenol A. So decrease use of plastic. We're trying to get rid of plastic altogether and store your food in glass. Drink your water out of stainless steel or glass. Be careful with cosmetics. Read labels on cosmetics. There's something called parabens that are in cosmetics. They're a preservative. They also mimic the hormone estrogen. So we want to not use, ban cosmetics that contain parabens, in other words, because there's so many companies now that are making organic cosmetics with no parabens. So that's what we want. And generally the diet, we want to go as organic as possible so that we eliminate the pesticides, and also as vegan as possible. So another link to breast cancer would be the intake of meat, dairy, sugar. So the diet should be, no sugar, only maybe from fruit, a little bit of honey, a little bit of maple syrup, but no white sugar. Minimal amounts or no amounts of meat. Meat and dairy increase the hormone called IGF-1. IGF-1 is the strongest hormonal link to breast cancer. And it needs to be a high fiber diet. So with a high fiber diet, so that could be chia seeds, flax seeds, psyllium, and legumes. Legumes are high fiber. We sweep out more estrogen. So for us to dump the estrogen, and we need a high fiber diet, and also lots of water. So those are some of the things we can do. There's more, but let's stop there for a minute.
Thank you. Those are awesome. I hope everyone's had their notebooks out, because I sure did. Yeah, I mean, it's interesting. Like, I know you're very evidence-based with your recommendations.
Absolutely.
And yet there's still so much controversy around the phytoestrogens and the vegan diet. And, there's such a push right now to eat more paleo, or the keto diet's really popular right now. But I don't feel like people are taking the whole context of health in effect there.
No. It's funny. It's interesting. People focus on one thing, right? And then they go on the bandwagon of a diet that does that one thing without really questioning, well, if you're on the keto diet, how many antioxidants are you actually getting? How much fiber are you getting? Are you getting 45 grams of fiber a day so you can sweep out more estrogen? And are you having 3 bowel movements a day on the keto diet? So it's these sort of things. We have to, I'm not against any diet so much as I know what some of the protective factors are. So in terms of breast cancer, it's low or no meat, it's low or no alcohol, it's low or no sugar, it's low or no dairy fat. It's the fat in the dairy that's a problem. And it's organic, and so not only that, but also if you look at the countries in the world where there's the lowest breast cancer, that's the diet they have. Mm-hmm. India has low breast cancer, primarily beans and spices and rice, right? China had low breast cancer, tofu. Japan has low breast cancer. Tofu and seaweeds. Africa has low breast cancer. Beans and lots of exercise. So and what are the countries in the world that have the highest amount of breast cancer? Belgium, France, Denmark, and Holland. What do they eat?
Lots of cheese
and
meat.
What's the first thing that comes to your mind? Cheese and meat. Cheese and meat and alcohol and meat. Yeah. They have the highest breast cancer rate. So you just look at that and it's common sense, So I've been studying this for a long time, and every year I look at more research and my basic conclusions that I came to 20 years ago haven't changed. They haven't changed. So the only thing that's been added is the importance of the vitamin D.
Yeah, I've been seeing studies continue to pop up around alcohol, especially around breast cancer lately, and it seems that no amount is safe anymore. Is that accurate?
The amount that seems to be acceptable is 3 drinks or less a week. 3 drinks or less a week. Yeah.
Okay, so for celebrations.
Anything above that will increase the risk, and the more there is, the more it increases the risk. Well, when the liver, how important the liver is, and in detoxing hormones, detoxing environmental chemicals, and how damaging alcohol can be if it's excessive for the liver. So that'll be one piece. Also, alcohol increases glucose, sugar. So insulin is another hormone. If our insulin levels are higher, we have a 3-fold increased risk of breast cancer. If estrogen levels are higher, we have a 2-fold increased risk of breast cancer. If IGF-1 is higher, we have a 7-fold increased risk of breast cancer. So the IGF-1 goes up with the meat and dairy. The insulin goes up with sugar and alcohol. The estrogen goes up also with, cheese and eggs and meat and fat. So all these things are important to note, right? To find the balance of what we're going to do for our own particular case.
Mm-hmm. So some of the statistics around breast cancer rates in Canada are pretty alarming right now. And, the latest from 2017 from the Canadian Cancer Society said that 1 in 8 Canadian women will be diagnosed with breast cancer in her lifetime. Do you feel like this is something that is elevated and going up because of environmental issues, or do you feel like it's early diagnosis is more common, or maybe a combination of both?
I think it's a combination of both, but not only that. If I look at most of my patients and even I ask them, why do you think you were diagnosed with breast cancer? Most of the time, the answer is stress. Most of the time, the answer is stress. So the thing with breast cancer and all cancers is that they're multifactorial. There's environmental factors, there's emotional factors, there are dietary factors, there's hormonal factors, there's lifestyle factors. It's all of those together that will, and there's genetic factors too, that will result in a cancer diagnosis. So we can only focus on the ones that we can do something about. But if you think about, if I look at my own life, I'm much busier. Than my mother was. I'm trying to accomplish much more than my mother. Now when have women had to raise their kids, make money, have an education, have a career, do the laundry, make the dinners, clean the house, and try to stay fit all in one lifetime? It's almost impossible. There's no easy way to do any of that. And you look at all the number of single women there are now, and then single mothers there are now, and then you look at the kind of stressors we have, and then you think about how that impacts our children when they're young. We really do need to rethink the structure of society. I hate to say it, because there's way too much stress on women. Mm-hmm. And so that's part of it. There's a link between breast cancer and certain kind of psychological conditions. I teach an online program once a week, the Healthy Breast program, and I completed one group. It's 12 weeks. I completed one group a few weeks ago. And there were about 5 women in the group who had breast cancer and another 5 or 6 women who hadn't. And with those women who had breast cancer, we did a little exploration of what were some of the emotional factors in their lives. And almost by chance, we discovered that all of them had had a traumatic separation from their mother when they were under 5 years old. Either the mother abandoned the family, or the mother went away for 8 months or 2 years or something. And we know in terms of the research on breast cancer that there's a link between a second loss after a first loss. So women often, not often, some women will be diagnosed with breast cancer after the death of someone they love in the family, but only when there was a similar death or separation when they were a child. So a lot of it can be related to trauma. It can be. We need to kind of dig and look for what are the emotional factors too that are underlying breast cancer in each individual woman, and work with those as well as the diet, as well as the supplements. Also, it's very important that each of us has some sort of relaxation practice on a daily basis. Ideally, we want 20 minutes every 2.5 hours where we chill out and we either have a cup of tea, have a nap, sit down and meditate, go for a slow walk, focus on our breathing, listen to music. That's sort of what the body needs to reset. And Western society, and myself included, the tendency is to push, 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 get more done. So we don't allow ourselves to have that relaxation, which for hormonal balance, the balance of cortisol and the regulation of the autonomic nervous system, and for us to be in touch with ourselves, we need those little relaxation breaks. That's another thing that needs to be built in. And that's coming, with mindfulness in the schools and more yoga in the schools and more people doing yoga. I think that's coming for sure. But I would say, I think of cancer diagnosis now after working with women for so long, is that often it's an opportunity to become whole because a part of themselves has been ignored, whether it's they're in a marriage that they're not happy in, or whether it's they're in a job that isn't right for them, or whether it's they've been living a mold that really isn't authentic for them. It's an opportunity to actually say, am I being the person I want to be? Am I being the person, is this the life I'm meant to live? Because cancer is a threat to life. And so sometimes we need this huge threat to kind of give us a kick to say, no, it's not, start living, to give us permission to live a different life. So there's that too. It's important for every woman to kind of ask her to just assess, is this the life I want to be living? Am I expressing myself authentically? Do I have a loving partnership? Am I in work that I enjoy? In my creative time, am I doing something valuable? So meaningful. It's that whole meaning purpose thing that's important. So there's a lot of factors.
Mm-hmm. Oh, that's pretty fascinating. I think it was from you that I learned about the autonomic nervous system cycles and the taking a break, because I talk about that every day.
It's so important and it's so obvious, right? And if we miss that, we miss everything. And just slowing the breathing down, right? Just slowing the breathing down to 3 to 5 breaths per minute. If not all the time, but just for 11 minutes a day, it's huge in decreasing stress and trauma. Yeah.
Yeah, I just like to reinforce with people that you can't heal unless you're in a state of relaxation. And if we're going all day long without a break, it's like, how can our bodies repair? Yeah. We're not in the right state.
And how can we be in touch with ourselves?
That too. Yeah, I agree that, breast cancer or even a scare, like even a lump, and having to go through the process is often a really big wake-up call for women to, take a look at where they're at and what, what's not fitting. I find that usually it starts with looking for the physical cause, like, what's going on with my estrogen. And then it starts to go into the deep dive after that.
That's right.
Mm-hmm.
You have to usually women come to me newly diagnosed or while they're going through chemo or something like that. And all I can do at that point is help them go through that stage, you know. So when I'm working with a woman with breast cancer, there's a lot of different stages, and hopefully this is like a multi-year journey, you know, at least a 3-year journey, and hopefully longer than that. So there's some women I've been working with for 20 years, you know, and just monitoring and keeping them on track. So the other thing to recognize is once a woman has this breast cancer, there's a possibility of a recurrence. And it's so whatever the lifestyle shift, there's a lifestyle shift that's demanded. It's not like you heal from cancer and you're done with it. It's we need to reorient towards life. And I like to tell them, well, now you're working on longevity. Forget the cancer recurrence. Because the same factors that will help prevent a cancer recurrence increase longevity in general. They prevent Alzheimer's disease. They prevent heart disease. You know, the same diet will prevent Alzheimer's and heart disease, you know. So I try to reorient them. So instead of it being fear-based, it's wellness-based, to maintain the exercise, to maintain the vitamin D, to maintain the more vegetarian diet, etc., to maintain the self-care practices.
Mm-hmm. Absolutely. So can we get into a big question around screening? Because this is something that I get asked a lot about is, you know, when and if to do mammograms, ultrasounds, self-breast exams have been out of favor lately, which just baffles me. And then thermography as well. Like, how do they all fit into your view?
Yeah. Well, first of all, I think girls should be taught in high school, as soon as they have breasts, to do breast self-exam. So it just becomes something like flossing your teeth. So that there's no fear about it. It just becomes a regular habit, you know, like flossing your teeth. So I think that's important. And one of the things, I teach this Healthy Breast program all over the world. I think I've taught it in about 15 different countries. And as I go to all these countries, many of these countries don't have access to mammograms because they have to pay for them. And so they don't do anything. So, and they don't trust their doctors. So they don't do that. So they're left with no screening. And so I think what we need is a global push to bring back the breast self-exam in a very big way, and to have women educating other women in breast self-exam. I think that's very self-empowering. Of course, it's not going to find all breast cancers, but if it becomes just a habit that we recognize, you know, kind of like used to be putting on sun, not that I recommend putting on suntan lotion, but, you know, the sun is bright, put on suntan lotion to protect yourself from skin cancer. Okay, the breasts are vulnerable, do a breast self-exam to become more aware of your breast tissues, so that if something's off, you'll notice it before it's 5 centimeters, you know. I was just at the yoga show in Toronto this last weekend, and we made this little door hanger that has on one side how to do a breast self-exam very kind of quickly, and on the other side these 12 tips for breast health. So this is the sort of thing we need. Is everyone needs this door hanger.
Yes.
And I'll post it, you know, where you can order it, not order it. You can actually download them. If you want to print them up, you can download them from mammalivefoundation.org, okay, for free. And then if people want to print them up for their patients, this is the kind of thing we need. So, so everyone needs to do breast self-exam and learn it. And then the next kind of screening, thermography is a good screening, not for detail, not for do I have breast cancer or not, but in general, what's that breast tissue like, and do you need to do anything to kind of reverse a particular tendency? So I think that women maybe before age 50 could do thermography once a year, once every 2 or 3 years. I think that's a good thing. But it'll miss certain cancers. And with women with large breasts, it's not as accurate. So it's just recognizing, you know, the limitations and the strengths of these various techniques. But it's painless, and there's no radiation. There's also, I think every woman, probably from age, I would think from age maybe 25 onward, I think it would be great to do an ultrasound once a year, just to have a look, you know, an ultrasound once a year. So the ultrasound is part of just a regular checkup with their GP. Why not do an ultrasound once a year? And to monitor any cysts that are there. So it becomes also a routine and a habit. Otherwise, women just don't do it, you know.
Mm-hmm.
In terms of mammograms are not useful in women under age 40 and sometimes under age 50 because the breast tissue in these women is already dense. And dense breast tissue, that means there's more glandular tissue present. And dense breast tissue looks on a mammogram like white. Breast cancer looks white. So you can't see the breast cancer if the breast tissue is dense. So it's only after age 50 that that dense breast tissue is replaced by fat. So after age 50, mammograms are more useful. But so the research on the mammograms, and I'm sure you know this, has shown that whether women get screening mammograms every year or not, it makes no difference, absolutely no difference in the number of women who die of breast cancer. So that early detection from mammogram made no difference in whether those women live longer or not. So why are we doing it if it makes no difference? And so certain European countries have stopped doing screening mammography. In the United States, they still start at age 40. Canada generally still recommends something from age 50. So I would say the problem with screening mammography also is often the women that are recommended to have that done are women with a strong family history of breast cancer. And those are the women most vulnerable to the radiation from those mammograms. And we know that there was a Canadian study years ago that showed that women who had a mammogram once a year, screening mammogram between age 40 and 50, actually had more breast cancer after age 50 because of those mammograms, because of the radiation from the mammograms. So it's a tricky, really thing. I'm not against mammography, but I think it should be used only when you find a lump or something suspicious, not as a screening, unless it's after age 50. And then I would say combine it, maybe do an MRI 1 year if you can, a mammogram the next year, 3D ultrasound the next year. Try to reduce the amount of mammograms, but don't give up not screening somehow, use ultrasound or 3D ultrasound or MRI. And the women with a strong family history of breast cancer should be doing the MRIs plus the 3D ultrasound. That'll pick up more without the radiation from the mammography. And then if something is suspicious, then they have the mammography to kind of figure out what it is. It's not easy because there's no perfect tool for screening. And then I think that every woman, again, probably age 25 onward, should have a clinical breast exam with their doctor or naturopath or nurse practitioner once a year. So if we had clinical breast exams once a year and that was done, and they were done well, because clinical breast exams done by an expert can pick up 70% maybe of all breast cancers. I think all women should be doing their monthly breast self-exams, from teenage years onward. The best time to do that if you're menstruating is on between day 3 and 4. So if day 1 is the first day of your period, then day 3, 4, or 5 is the best time to do those monthly breast self-exams. Did I answer your question?
Yeah, absolutely.
Yeah.
I agree. It's really complicated,
It's very complicated
to make recommendations, and specific.
Women just give up because
of course
the advice is changing all the time.
And specific with women who would be listening to this podcast with perimenopause, I find that there's a lot of breast changes happening in this decade with the changing hormones and the estrogen storm and the drop in progesterone. Yeah. So I find a lot of women are going through the annual, find a lump, do an ultrasound, get a mammogram, possible biopsy to find nothing because the screening isn't adequate for their age group, right? The mammogram is inconclusive.
There are, when I wrote my Complete Natural Medicine Guide to Breast Cancer, when that book was published, I was looking at all kinds of research to see what else is there? What else could we use for screening, And there are blood tests. So one study was looking at, I think, 8 different blood tests. And if you did all these 8 blood tests, which are not available routinely, they're not available. But if we did these 8 blood tests, there would be a 90% accuracy of diagnosing.
Wow.
That's
really?
Mammography and MRI. 8 blood tests are cheaper than mammography number, but they're not being done.
And that exists.
Change they exist. So blood tests exist. If we combine a whole bunch of them, that would tell us with 90% accuracy if a woman has breast cancer.
Wow.
Yeah. And I list those in I think it's in the Complete Natural Medicine Guide to Breast Cancer. With those, I forget what they are now, but they're available. So that's what we need. We need a panel of blood tests that's accepted. Mm-hmm. Unfortunately, it'll put the the screening industry out of business, and that may be the reason that it hasn't been developed.
Wow. So that's pretty incredible. Yeah, it's interesting that hasn't come to our attention yet as clinicians. Mm. Yeah, that it's only people like you.
We have to have our own private lab to do them because it's not available through the current labs, Mm. Which is a great thing. Why don't we do it, right?
Okay. We should do it. Yeah, that's interesting. Yeah, I mean, I can speak from my own experience with screening as well. Like I host a thermography clinic in my right. downtown clinic a couple of times a year. And, in the fall, I had a highly abnormal breast thermogram, which for me was a good wake-up call of, my stress levels were too high and nutrition needed some work. And it's interesting to go through the process of putting yourself in the patient's shoes of, okay, what do I do next?
Yeah.
Yeah.
So what'd you do?
What did I do? Well, number one, I took a good close look at how I was living my life. Because there were a lot of the factors that you mentioned in our, your proactive steps that I could have been doing better at the time. I'd had a very stressful year and had been definitely neglecting my own self-care and sitting way too much and not sleeping enough and all of those things. I consulted a really dear friend of mine who's also a naturopath and asked her, what do I do? And she put me on a plan with some lymphatic support and some homeopathic drainage, again, based on knowing where I was at in my life. Started doing some breast massage with some nice oils and reshifted my nutrition again, which was what I needed.
Fabulous. In terms of breast self-massage, I want to share this on pomegranate seed oil. So the oil from the pomegranates is a really great base oil for breast self-massage. So you can do pomegranate and olive, maybe that mix, half and half, or just pomegranate oil. So the research on that in a laboratory setting shows that it inhibits breast cancer cell growth by 90%. Wow. So just rubbing pomegranate oil on the breast inhibits breast cancer growth, at least in a laboratory setting, 90%. And then certain essential oils have been found to really powerfully kill breast cancer cells. The top one is thyme, essential oil of thyme. And the next three are lemon, chamomile, and cinnamon. So to make just a massage oil for the breast, the base is pomegranate seed oil, and then you have essential oils of thyme, lemon, cinnamon, chamomile. Will help to inhibit breast cancer cell growth. That's a big deal.
Amazing. Again, I hope you had your pen and paper handy. We're going to put a whole lot of links from the show to some of these resources that we've mentioned, just so that you're able to find them more easily as well, because there's been so much value here. I think we've covered most of the questions that I had here in our roundabout way. Is there anything else that you'd like to add to finish up?
Yeah, we have one of the things. So my mission really is to try to get this information out there so women know what to do to help reduce the risk of breast cancer. And I started a foundation called the Mammography Foundation, which is a nonprofit, a Canadian nonprofit, but we have an international reach. And one of the things we've done is last October and the October before, we put out 1 tip a day on social media to reduce the risk of breast cancer. So we have 31 tips. And if anyone would like to share those on their social media pages or with colleagues or friends, we would love your help to just spread the word, is if if every year we revisit these 31 tips, it will become part of the global consciousness. So we've translated these tips into 15 languages, and they're being shared all over the world. So those are on the website, mammalivefoundation.org. And if anyone wants to, actually, if you sign up for the email list there, you can just email me if you want. We can add you to the fall campaign, October campaign, and then or you can share it directly from the website through there. That'd be great. It's just about getting the word out about how easy it is to reduce the risk of breast cancer and how important it is. Or in a few generations, we won't have breasts. We have to act now. Serious. It's serious.
Yeah.
I want to share one more thing. Between 2008 and 2012, the global incidence of breast cancer rose 20%.
Wow.
In a 4-year period, the global incidence of breast cancer rose 20%, and it was rising, 2 or 3% every 8 years or something like that before then. So there was a huge jump in those 4 years, mostly in third world countries who are becoming more industrialized. So, but this is what I think about, is I can sort of envision the future. I love breasts, and I want us to keep them, and we need to do something. We need to take it seriously.
Yeah, I 100% agree. And, and the more women that we teach in this age group, the more who are going to be sharing with their daughters and, in the generations to come. I mean, I have a teenage daughter, and her grandmother on the other side died of breast cancer quite young. So this is something that I'm really passionate about with her. And interestingly, if, we sort of jump back to food just for a second, side note here, I think we're doing something right. Her favorite foods are broccoli, shiitake mushrooms, miso soup, tofu.
Fantastic. Yay.
I know, since she was tiny.
Yeah.
It's like she knows.
She knows.
Yeah.
It's going to be a naturopath. Yeah. Pomegranate is another wonderful food. Every part of the pomegranate is healing. Obviously, the spices. We all have to use more spices. Turmeric, oregano, rosemary, thyme. All the spices are beneficial. So the countries that have the least breast cancer have the most spices. Yeah.
Mm-hmm.
Yeah, and the other thing is, if anyone's interested in the Healthy Breast program, I offer it 3 or 4 times a year as an online course. So the next time will be in September. And I'm also teaching it in Italy and in China. In Italy in September, October, in China in December this year. And that the courses are listed on the website mammalive.net, mammalive.net.
Wow, thank you so much. We will put the links in the show notes so that you can find them both on YouTube and with our podcast notes, so it's easy to get to. And I'm so grateful for having you here today. As usual, I've learned a ton, and there's been a lot of evolution since I first did the course with you, and I've been following your tips online too. So so much to learn, and it's just encouraging to hear how many things that we can do preventatively, because it does sometimes feel really dire when you see case after case of newly diagnosed breast cancer.
Thank you, Shawna. Yeah. It's been wonderful to spend time with you.
All right. So thank you for listening. And if you like the podcast, please subscribe and share with your friends. We would love to hear comments if you have any, or any questions about the show. We'll definitely get back to you. Thanks again, and have a wonderful day.